Right, we move on now to Europe, to Professor Mehmet Ungan, who's the WONCA Europe president. And can I remind you, Mehmet, to unmute yourself as you start.
Thank you, Garth. I would like to start my words for our colleagues and for the member organizations. Happy Easter. I think today most of you would like to celebrate today with your families. And I would just like to summarize some spot things, but I will not give graphs and such kind of numbers to you here, because the European CDC and the WHO Europe websites are already having the very accurate numbers for the Europe. And Europe is a really diverse continent if you compare with the other regions, I think. Some of the countries already started earlier to identify the cases and to take the measures. And according to the cultural diversity, some of the population in the countries were really sticking on the precautions and the measures. But unfortunately, I can tell you that maybe it's not correct, it's not scientific yet, but it's an observation. When you look at the numbers, the southern countries have, I think, have not been very keen on obeying the social isolation and such kind of things because of the cultural variations. And before it was an advantage for those countries to have very warm relations and social contacts, but I think this time it's not a good advantage for them. And when we look at the WONCA Europe website, you will see that there is a COVID-19 resources section. Then if you click it, you can just go to the numbers, the actual numbers through the European CDC and the WHO Europe. There are some, of course, precautions and also changing measures across Europe. Some countries already, as I said, started earlier, and some of them, like Turkey, for example, the first case was 11th of March and increasing terribly right now. And when you look at the numbers will change in the next 15 days, as I see. But for some countries like Germany and the Nordic countries, Norway especially, I think Anna will tell you more. And those countries are already started to think about how to the transition phase to the normalizing the life. So the diversity is very, very, very marked here in this continent. What we have had the predictions, if you look at the predictions, I can practically tell you that because of this diversity, I think even in October we will not be able to travel freely, I think, in Europe at least, because some of the countries will still have the fight against the corona, and some of them already will be over. So what we did is WONCA Europe, we tried to design some kind of statements for our member organizations to use them when they are communicating with their local governments, especially trying to take place in the pandemic teams, I mean the brain teams. They would need the international support. So that's the reason those statements were very useful. I know many countries used them, and now they are in the pandemic councils of the country. And each country has a different need, of course. And one of those statements, the summary is, you can see in the screen now, we tried to make a presidential letter and a video. So in those statements, we just mentioned that first of all, the family doctors has families also, and their families are needing them for sure, and they have to protect themselves, and they have to be careful with healthy food and careful work breaks, and personal protective equipment, as Shabir already mentioned, and they have to limit face-to-face consultations to a minimum. And while doing them, they may use the technology wisely, and they can think how to improve them in daily practice with new ethical and legal regulations, which should be worked together with the government also. And we mentioned and we discovered that we have to be extremely careful what to post on social media, because we have an influential voice in our populations, especially. So we have to minimize posting on social media to absolute science. And if this is uncertain, should think twice before posting. So the rest is the family doctors also must urge their governments to include them into pandemic management leading teams, as I told you. There should be call centers. In some countries they have, but still in some countries there are no call center for the citizens. And it would be nice for as the voice of the population, the family doctors could continue to insist on having these call centers for the public. We can change it, Harris.
Mehmet, you're 5 minutes already, so can I ask you to speed up just a little? Thank you.
Yeah, for sure. I'm sorry, yes. And there are three items that I should have been mentioning. We are confident about the scientific decisions by the committees and councils, scientific councils, and the governments should also rely on the science, which is the only truth. And even the governments can follow all the precautions of sciences in each country without any political adaptation, which is very important, I think. And quarantine, isolation, surveillance, case detection, such kind of words should be used in the scientific meaning only. So this is also another one. And we can just change, and this is the last slide, I think. Yeah, just we try to work on the occupational diseases and try to include in some countries the COVID-related disease to be an occupational disease for the family doctor's rights, and it should be accepted. And some countries already put them into their regulations. And another very important item is we are expecting an increase in the violence towards health professionals, even in the Europe, in some parts of the Europe. So I think it will be very important to include the violence measures towards the health workers in the regulations. This is an important topic I should remind. And also increasing the capacity by using the family doctors associations in collaboration with the governments. Thank you for listening.
Thank you very much, Mehmet.